On behalf of the Centers for Medicare and Medicaid Services, the Administration for Community Living, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services and Supports webinar series. My name is Julie Cahoon and I work for Kaufman & Associates. I will be the moderator for today's webinar. Please note this webinar series is supported by the Centers for Medicare and Medicaid Services. The opinions, findings, conclusions, and recommendations expressed in this webinar are those of the presenters and do not necessarily represent the official position or policies of the Department of Health and Human Services or the Centers for Medicare and Medicaid Services. With those announcements made, I'd like to welcome everyone to today's webinar. Today's webinar is titled Uniting Nursing Homes and Tribal Excellence, Needs Voiced, Needs Met. Today's webinar is supported by Unite, the Uniting Nursing Homes and Tribal Excellence organization. Today will be a discussion about Unite and some of the benefits Unite and memberships with the organization will provide. Our presenters today will be Tammy Reed. She is the president of the Unite Board of Directors. We also have Joseph Ray, who is the vice president of the Unite Board of Directors. Also joining us today is Ron Ross, who is the treasurer of the Unite Board of Directors, and Susan Foyer, who is the secretary of the Unite Board of Directors. We will also have Debbie Dijak, who is a member of the Unite Board of Directors, as well as Frances Stout and Lisa Johnson. I will now turn it over to Tammy for an introduction to today's topic.
Thank you. My name is Tammy Reed, and I'm currently the administrator at Morningstar Care Center in Fort Washakie, Wyoming. Our nursing home is the only Native nursing home in the entire state of Wyoming, and I'm also the current president of the Unite Board of Directors. I'd like to give you a little background about Unite. Unite grew from a group called TREACH in 2014, and TREACH was the brainchild of a beautiful lady named Kay Branch. TREACH stood for Tribal Educational Nursing Home Collaborative. Kay's passion was working in Alaska, improving care for Alaska Native elders, but she realized that she faced issues with long-term care services and support and decided that everybody else across Indian country probably had those same concerns. And so she reached out to people from Alaska and Hawaii and Indian country, and we all agreed with her, and a collaboration was formed. So we felt like we could accomplish more as a team, trying to deal with issues, whether it's workforce development, education, best practices in our Native nursing homes, and focus on cultural needs. In 2016, we changed the name to Unite, which stands for Uniting Nursing Homes and Tribal Excellence. We partnered with KAI, the Kaufman Institute, and they have been instrumental in helping us produce our best practice reports, our monthly newsletters, and establishing a CMS website. Over the years, we broadened our scope to include people with disabilities, assisted living, and all other long-term services and support. This year, we felt the need to become a 501c3 nonprofit corporation. This will help us greatly with the ability to apply for funding. And we also established a board of directors last January. We revised our mission statement. Our mission statement for Unite is to partner with and be a resource for Native American, Alaska Native, and Hawaiian tribes to improve the quality of life through the implementation of the evidence-based practices and culturally relevant education and training. Our vision for Unite is to raise and enhance the quality of life for Native American, Alaska Native, and Hawaiian elders, and including people with disabilities. We welcome new members, and we hope those of you listening today would like to become a stakeholder and a member in our Unite group, and we're thrilled that you're with us today. And now I will turn it over to Debbie. Or no, to Frances. I'm sorry.
Thank you, Tammy. Good morning, everyone. My name is Frances Stout, and I'm a member of the Thomaw Nation. As of this year, I'm no longer chair of the Tonka board as I have been for several years. I'm now the board secretary treasurer, which puts me on a fast track for learning fiduciary responsibilities. Now for how we met the challenge of bringing our elders home. First, our nation is 2.8 million acres of land located in the Sonoran Desert of Arizona, and is the second largest native nation in Arizona. Our closest cities to the north are Tucson, Phoenix, and Casa Grande. Our enrolled population is around 30,000, and of this number, more than half do not live on the reservation. Our elder community is around 1,800. Our nation considers ages 55 and over an elder. Now for some pivotal points in the history of Archie Hendricks Skilled Nursing Facility. In 1978, the nation had the University of Arizona do a feasibility study to determine the need for a skilled nursing facility. It was all part of a master plan to build a skilled nursing facility on our lands. Unfortunately, the cost of constructing and operating a skilled nursing facility was not feasible. 15 years later, in 1993, our first casino opened. The nation commences receipt gaming revenue. In August of that same year, 1993, the nation allocated the primary funding for planning of the SNF. It was during these 15 years that kept the perseverance of 3 women and 1 man, our champions. They kept the voice of our elders who were in off-reservation facilities before our chairman and council. The champions repeatedly reminded the chair and council our elders need to come home, where they would enjoy our traditional food, speak and hear our language, and visit with family. When the chairman said, "Here is planning money, we're just going to head this project. Who will head this project?" One of the champions stood and said, "I would." The other stood and said, "We would help." This group became the task force. And soon after, the task force became the advisory committee. It was at this time Mike Flood and I were working for Indian Health Service, and we were asked to become the liaison and to join the advisory group. My thoughts at this time were, I wonder if the group knows this project will cost money now and more so in the future. However, soon after joining the group, I was taken in by the passion and commitment they had for the work of bringing our elders home. The advisory group hired a project manager and a young man who knew the process needed to move this project forward. I think it's important to know it took champions with persistence to bring us to this point and a project manager to move us forward. In 1996, which was 3 years later, our business plan was prepared. The business plan considered the construction of 60 beds, a 60-bed SNF, and other services required to provide care for awesome elders. The structure followed, and not with issues. At one time, we had to consider taking the construction company to court, but those issues were quickly taken care of. In December of 1998, the nation charters Tonka with continuum of care mission. The charter, I think, was an unusual move and truly outstanding. It gave us the authority to move as we saw fit. A year later, in December of 1999, the Tonka board was established with council approval, of course, and our first challenge began: bring our elders home. 3 years later, in November of 2002, Archie Hendricks Senior Skilled Nursing Facility opens a 60-bed facility, admitting its first 4 residents. We applied for certification from the Centers of Medicare and Medicaid, making it possible to bill for services. Medicaid in Arizona is called Access, Arizona Health Care Cost Containment System. To date, we have given services to 1,854 individuals. 14 years after opening our facility, we then opened a 11-room Solo Optum assisted living residence. At that time, we had 17 residents in the SNF that did not need licensed caregivers and actually would be fine in an assisted living residence. The residents had a choice. They either could remain in the SNF or move to the assisted living building. 10 residents chose to make the move. In August of 2015, Tonka's established a 501(c) foundation. It was created to enhance support for residents' personal needs, such as clothing, Christmas gifts, and it even gave us some money to provide incentives for our staff. In November of 2016, as you all know, the mega rules were upon us. They were to be implemented in 3 phases, 1116, 1117, and 1119. There were changes in administration and staff. It was a very turbulent time for our team. During this time, our star rating dropped from a 5 to a 2. And as you know, we are one of the many facilities being a candidate for special focus facility. This was quite a shock for everyone, but we had a plan. We first notified everyone, including our residents. This was brought to the resident council, and the president of council immediately said, what have we done that they should do this to us? And I think the fact that she used we instead of you, what you have done, was important to us. It meant that they felt very much a part of the facility, part of the program. But we have a plan. We're in the midst of implementing it, and with our next survey, we should know just where we truly stand. In closing, looking back, if we had resources that we could call upon for assistance like Unite, we would think we would have, I think, moved forward much quicker. I came across this quote and saw it fitting for my ending. Individually, we are one drop. Together, we are an ocean. So let us unite and become an ocean. Thank you.
Thank you, Frances. We will now hear from Ron Ross.
Good afternoon. My name is Ron Ross. I'm CEO of Native American Health Management, and like Tammy said earlier, Unite has been a journey. The journey has been fruitful with the ability of becoming a nonprofit tax-exempt organization. We believe that we're poised to move tremendously into the future. We feel that the comments that Frances just shared with everybody gives people an opportunity to understand the commitment that's necessary to move forward, along with the leadership that it's going to take. And like Frances, it takes a champion, somebody from the tribe. And we at Unite believe that we can help those champions that want to move their tribe forward, whether it's with a nursing home or assisted living or other home and community-based services. We have applied for a grant that the Administration for Community Living has released to become a resource center for tribes. Hopefully, we are successful, and even if we're not, the commitment from the members of Unite will continue to go forward. But with the grant, it would certainly allow us to move forward faster. We are in the search for an executive director. If anybody has an interest in that, there's an address that you'll see that you can contact us, and we'll get you to the right people on the search committee so they can help you answer questions, the job description, and whatever else you might know somebody that would have an interest in having the passion with us to move Unite forward. The other thing that Unite has been active in and has been for several years is we're a member of the Tribal Technical Advisory Group for CMS and have been now for several years. We continue to participate with CMS, and without CMS's help for our website and just working with KAI and Unite, we wouldn't be where we are. And so I think it's a team effort. Everybody's trying to get information out there for tribes so that they can improve their long-term services and supports, and Unite certainly wants to be a partner in that. One of the things that we did a webinar for CMS here a few months ago on financial sustainability. That can be found on the website. So there's some good information on that webinar to talk about how tribes can go about and financially afford to operate a nursing home. So there's a lot of information the folks at Unite can help you with, and all you have to do is reach out to the address and telephone number that you'll see up there, and any one of us would be happy to work with you on that. And so now we're going to move the slide on to Debbie.
Thank you, Ron and Francis, both. That was really excellent information. This is Debbie Dijak. I'm a registered nurse. I've been very involved with Unite since 2014. I'm currently with Health Services Advisory Group, which is a quality improvement organization in the Phoenix area, but I'm also serving on the board for Unite. And so I'd like to also introduce my colleague, Lisa Johnson. Lisa, would you like to introduce yourself too?
Sure. Hi, everyone. My name is Lisa Johnson, and I work with Mountain Pacific Quality Health. We are the Quinn QIO, or Quality Innovation Network Quality Improvement Organization with Mountain Pacific. As I said, we cover 4 states, which is Wyoming, Montana, Hawaii, and Alaska, and also the Guam and American Samoa. So there's quite a bit of land in between our states, and so that is what Mountain Pacific does. We're one of 14 Quinn QIOs across the U.S., and for many folks, I think just a quick orientation to what a Quinn QIO is and what we do might be helpful. We are contracted with CMS to work on data-driven initiatives to increase safety, to make communities healthier, to better coordinate post-acute care, and to drive clinical quality improvements, and to spread best practices. So really, when we talk about the topic today being needs voiced and needs met, the work of Quinn QIOs in responding to the needs of our tribal elders in nursing homes was certainly a very good fit. So like Debbie, I've been part of the Unite group almost since its inception. And in Alaska, we have 5 out of our 18 nursing homes which are tribally run and operated. So for me personally, it was important to be involved at this level so that we could help engage our tribal nursing homes with some resources with other like facilities that are really focusing on the culture that goes along with the care. In Alaska have had really great luck working with partners, as we talked about, strengthened through stakeholders, in particular our long-term care ombudsman and our state survey agency, in addition to folks like the Alzheimer's Resource and our university friends, have all been key stakeholders in helping us, again, identifying what are those needs that are being voiced and how can we respond and provide some resources and expertise in those areas. So that's sort of my 2 cents worth. Debbie, I'm happy to turn it back over to you and let you kind of take the ball.
Thank you, Lisa. I appreciate that. And I have known Lisa since 2014. So basically, we both work for a quality improvement Quinn QIO. Health Services Advisory Group reaches out to 4 states. We're in California, Arizona, Ohio, Florida, and the U.S. Virgin Islands. And so the work continues with for Medicare, beneficiaries, which of course you would find Medicare beneficiaries in tribal nursing homes. The work that we do with nursing homes across these states there's no cost to that. So the Quinn QIO network is mandated through Congress, so there's no cost to the nursing home. And when I first found out about this, I was like, why wouldn't our nursing homes use this resource? Because it is a wonderful, just a wealth of knowledge. And so with some of the new CMS regulations that Francis Stout mentioned, for example, what's coming up here in November with the infection prevention rule, with the changes in QAPI and some other changes, these are the type of things that the QIOs can be very helpful with. I'd like to just say that as a group, Unite has always tapped into our stakeholders, and it's allowed us to strengthen and continue through these last 6 years. So we've always reached out to the long-term care ombudsman. Some of the geriatric resources, for example, early on were the geriatric education centers, which became the geriatric workforce enhancement programs, which were HRSA funded. And those specifically, we worked with the University of Arizona in Tucson, and I'd like to thank them for their years of support for our work. Also, we have, as Ron mentioned, we have always worked with CMS. We have our information is housed on the cms.gov website under Outreach and Education. We have also had early contact with Indian Health Service, Dr. Bruce Fink, and the Administration for Community Living, Cynthia LeCount. All of these people have been supportive and instrumental in keeping our Unite going so that we can do the work and meet the needs of the tribal elders, and specifically those in assisted living, nursing homes, and also with home and community-based services. So appreciate all of our stakeholders. I'd now like to introduce Joseph Ray.
This is Joseph Ray speaking from Laguna Pueblo. I'd like to thank everyone for listening in today, joining in today. Thank KAI and CMS, and also the board members of Unite, as well as Lisa Johnson from Alaska. One of the statistics I'll throw out to begin with my discussion is that I'm on the board of directors at Laguna Rainbow Corporation, which is one of the few nursing homes in the United States that is tribally run. We're a 56-bed skilled nursing home, and we've been in business for 30 years plus. And so again, I'm thankful to be part of this group. I'm the vice chair of the Laguna Rainbow Corporation, which again oversees not only the nursing home, but community senior services such as Meals on Wheels. So my slide is titled Impactful Engagement, Making a Difference. And the way we do it at Unite is through, or the way we want to do it, is through empowering our elders, ensuring that our elders have a voice in the creation of their care. And elders' needs have not changed over the many years. Because of information technology, we can deliver services in a quicker manner. But again, because of ruralness of many of our tribal communities, that can't always happen. But again, with our continued working together as advocates through Unite, we can achieve this goal. Education at all tribal events where elders are present. We would like to ensure in the future that we are able to do this. I think each of us, as individual board members, we do the best outreach we can in our communities. I'm here in New Mexico, and our members are made up of from diverse states. So again, we're trying to do that as best we can. Connection with tribal leadership. I'm also want to mention that I'm on a national level. I'm able to advocate on behalf of tribal elders and persons with disabilities, which I'm a member of that group. Advocate for more funding for our programs with my tribal leadership, such at major conferences in Washington, D.C. and throughout the United States. I am the Disability Subcommittee Chair for the National Congress of American Indians, where I've been in place for about 8 years now. And so again, I am trying to do my best to introduce the Unite mission and core values that we bring as members to our group, to a larger audience. And we're thankful again to have this webinar. Speaking again on the tribal priorities and the impact on long-term services and support. We have to maintain our relationship with the Indian Health Service, they being the major providers in many of our tribal communities. Here at Laguna Pueblo, we recently tried to take over our management of our own healthcare through the Tribal 638 system with CMS. And so again, but it's a long-term project and a long-term process that we are taking on. The impact of the Title VI legislation has been great. Again, Title VI and Title III, which ensures that our elders have homemaker services, and Title VI, Title III, and Title VI, which ensures Meals on Wheels. We deliver meals to over 6 villages here at Laguna. So the Title VI has had a major impact for our elders. Advocacy at the federal, state, and local levels. I again, because of my training as an independent living specialist, I know the value of advocating for services. Many on the tribal, federal, state, and local levels, and tribal level also. Many of our programs that enable and empower our elders to age in place, age in the community, have greater resources, through CMS, that takes advocacy on behalf by our people themselves, by our citizens, tribal citizens, and by tribal leaders who are our elected representatives. Here in New Mexico, I also advocate on the state level for independent living services to reach tribal elders. And at the federal level, again, with the Administration for Community Living, Title VI conference, we've been able to participate in that and go to the Capitol Hill and meet with our congressional leaders. And so again, advocating on all those levels is very key. We as administrators and program directors and all that make up our group of Unite, we do the best we can, but we also need our elders to be empowered with the knowledge that they can make an impact in those arenas, federally, state, and locally. And I'll finish up with talking about the National Indian Council on Aging. They're based here in Albuquerque, and they're another advocacy organization, but they have a diverse array of services, and we partner with them on the local level here at Laguna. They provide service workers through their CSEP program, and so again, I'm sure there's others that are familiar with that. If not, that's what Unite's here for. So again, I want to thank you for tuning into the webinar, and I'll conclude with that. Thank you.
Thank you, Joseph, very much. This is Debbie Dijak. And I just want to remind the participants that we do have our objectives, and we have met and looked at the first 4, and now we're going to move into understanding how to become a member of Unite as an important resource for tribal elders and adults needing assistance, as Joseph mentioned. And so Tammy Reed will now take over. Thank you.
Thank you, Debbie. We really would like to encourage everyone to join Unite. We're having a special rate for membership this month through October of $50. So that's really pretty affordable, I think. You know, we truly believe that our elders need to be able to stay in their own communities and receive the care that they deserve. We truly believe in helping with the cultural needs and the cultural identities of our elders, and allowing traditional foods in the skilled nursing facilities or assisted living, wherever they might be. We have worked very hard in Unite to get our voice out there, but we want our elders' voice to be heard on what they need. And by joining Unite, you can help us with this mission to be able to reach all of the people working with our native elders in Alaska and Hawaii and all across Indian country. We will be having, we're very excited. We're doing a collaboration with Leading Age, and we will be at their conference in San Diego, October 27th through the 30th. And at that conference, we will have our yearly annual Unite meeting, which we invite you all to join us, if at all possible. We just certainly continue to try to add stakeholders to the goals of Unite to work with us. The information is posted, and it's in also this PowerPoint. You can reach myself, tammy.reed@unitenatives.org, or ron.ross@unitivenatives.org. That is posted up under contact information. And Debbie or Susan, do you have anything to add?
No, thank you. Welcome, everybody.
Thank you, Tammy.
Oh.
No, go ahead, Susan.
Okay, my name is Susan Foyer. I'm a member of the Oglala Sioux tribe. I live in Pine Ridge, South Dakota. I am secretary of the board. But we do have a number down in Lincoln where the Unite office is. And everyone is please call if you have any questions. Area code is 402-464-0054. Or you may call me 605-899-2100. And we can help you with your membership, how to register, etc. So thank you much.
Thank you, Susan. This is Debbie Dijak, and we are really excited that our annual meeting is coming up in October as part of the Leading Age Conference in San Diego. And so, again, please join us. Please join us in San Diego. Please join us for the annual meeting, and please join Unite and help us meet the needs of the tribal elders that are out there in the tribes and communities that are providing these services, as Frances mentioned at the beginning of her presentation. So that concludes the meeting of our objectives for today, and I'll turn this back to Julie. Thank you.
Great. Thank you so much to the members of Unite who presented today. Now is the time for our question and answer session. So if you do have a question for Unite, please type that into the Q&A pod there, located at the bottom right side of your screen. Just type in your question, and then any of the Unite members will provide a response. So again, if you have a question, type that into the Q&A pod located at the bottom right side of your screen.
Thank you. And I see there's one question. This is Debbie. Where can we obtain a list of the tribes who participate in Unite? I can answer that. If anyone else wants to join in, that's fine too. There is an updated directory on cms.gov. And so if you look at the far right tab that says Outreach and Education, and then click on the link for American Indian, Alaska Native, and then go to the link on the left. And Julie, maybe you could put that up for the participants, how they access that. It says Tribal Technical Advisory information, and that's where Unite is housed. And the directory is right there, easy to get to, and it's been recently updated. I believe there's another directory of tribal assisted living facilities, which will be there soon also. Anyone else want to comment on that? Okay. Ron, there's a question, how does Unite work with health plans? I thought you might want to address that specifically, maybe with Medicaid, or I'm not sure exactly if they mean like private insurance or what they're saying.
Well, for nursing homes and even assisted living, but again, the webinar that we did a few months ago speaks volumes on how tribes can access Medicaid, or the tribal member can access Medicaid, and there's funding available a whole lot different than a normal nursing home if the tribe will do a 638 with IHS and then work with the state that they're in along with CMS. And while it's not complicated, it is a puzzle until you have to get all these pieces and you have to put the puzzle together. But Unite certainly is in a position to help people with that. And so I would say from our experience and probably Tammy's experience and Francis's experience and all of us that work with tribal nursing homes, Medicaid plays a large role in the funding for taking care of tribal members. So it's a huge part of the puzzle, and so you need to understand that. And Unite's in a position to help you with that information.
Thank you, Ron. Would anyone else on the board like to comment on that question? How does Unite work with health plans? Okay. Unite itself is not a health plan or an ACO, so we are working with tribes to, like Ron said, assist them in these processes. The next question is, what resources are available to tribes interested in providing long-term support services and assisted living services, and where can we find more information? Would anyone like to answer that?
Well, the Unite contact information, if you reach out to our contact information, we'll be able to respond. Again, we're hopeful to get the grant from the Administration for Community Living. That'll be a large role that the executive director will play along with other personnel to provide that information. We are hopeful to be that resource center for not only the lower 48, but also for Alaska Natives as well as Hawaiians. So, money's going to talk. And so as we get more members and our funds can grow, we can do more. But we're certainly in a position of responding to questions that people might have by just contacting Unite at the address on the slides.
Yes, thank you so much, Ron. That's correct. And then, of course, on cms.gov. But I think right on the slides, just reaching out directly to Ron and the address that's on the slides would be great. I do want to mention that we have monthly calls. They are the third Thursday of every month. We also have a newsletter, so it's really easy to request our newsletter. I don't know, Julie, maybe you could put the link to that so that if people want to join our newsletter, they can certainly do that. But it's always the third Thursday of every month at noon Arizona time, which is right now 3 o'clock Eastern time. What we do is we have a monthly call, but only the 3 quarterly is a membership call. So if you're a member, you would log on quarterly, and that would be in March, June, September, which is coming up, and again in December. Those would be the months that we actually have the members on. And sometimes we have speakers, and it's pretty good information. I see one more question here. What are some things health plans can do to help support tribes with long-term support services for tribal members? Ron or Joseph or Tammy, maybe?
Not quite sure of the question. Again, most tribal members do not have private health and long-term care insurance. So, you know, one of the things that Unite would be able to do is work with the tribes and their health committees to explore, you know, especially the Medicaid side, because what we find is there's just a reluctance to get involved with nursing homes because of the cost. But if tribes will be open-minded to look at how IHS through the state and CMS, it really can be almost negligible to the cost of the tribe. And once the tribe figures that out, they're a lot easier to get them to move towards long-term services for their elders.
Thank you, Ron. Anyone else want to comment on that question with health plans? And just, I mean, obviously we're a resource, but anything else that health plans can do to help tribal members with long-term support service? Anyone else? Okay.
This is Frances Dowd, and I do think it's very important when you sit down as a group, and this includes the council. If you have a committee on health and human services, it's very important that you look at the plan that you're going to put in place. But I think even more important is have the ability, and it's going to cost, to do a feasibility study to see if you have the wherewithal to start. And do you want to do the whole bit, long assisted living and a skilled care facility? I think more and more the long-term care is looking more at assisted living, group care type of care. So there's a lot out there, but I think knowing, number one, what the documented needs of what your particular tribe has, and moving from there. And remember also that these facilities that you're going to put together are actually just, to me, they are like a stopgap. They take care of the complications that originate with your chronic disease situation. So if you do some upstream thinking, think about the conditions that will bring your tribe to long-term services and support, and think in terms of healthy aging. I think that's where I know Tonka would like to move, is towards healthy aging, so that, because it's very costly. Facilities are very costly.
Thank you, Frances. Those are really timely, excellent comments. I'd like to go on to the next question, and it does say, what are the CMS changes happening in November? That was the slide that I spoke on. And Lisa, I'm going to let Lisa speak first, and then I would like to make a comment. So Lisa, please address that question. Thank you.
Well, wow, that's a big one. I'm glad I'm glad I've got some backup on that. So there are what are called conditions of participation for nursing homes, which are basically the big book of rules and regulations. And there's been a number of changes to those rules that will be going into effect in November. So for the nursing homes, there's regulations around infection prevention, trauma-informed care, abuse and neglect, and of course quality improvement. So it's kind of a big question to answer in a nutshell, but I guess the short answer I would just say is that there are conditions of participation, so regulatory changes that will be going into effect on November. And Deb, I'll let you maybe add to that if you can think of how to maybe add more without overwhelming or freaking people out.
Thank you. Yeah, that's a big question, but I'm going to just say this. My email is on the slides, and I would encourage you to reach out to Lisa or myself, and we will get back with you on some specifics, because these, like she said, are being implemented in phases. So there are some big changes in nursing homes that accept Medicare patients, that accept funds from Medicare, as far as some payment changes in how payments are made, quality assurance and performance improvement, which is a kind of how we look at things and making change in our facilities. Infection prevention is the role of someone who really needs to have some dedicated time to look at infections that may be happening in the facility and how to prevent them and treat them. And so we're happy to put you in touch with the quality improvement organization that works with your state so that you can get some help and some assistance. Currently, our quality improvement organization is working with Medicare right now, and I would like to just put this out there for any tribe in Arizona. We're looking for some information of what people are doing with the opioid use crisis that we see, and also with any initiatives that any tribal entity in the state of Arizona might be working on with the prevention of chronic kidney disease moving on and getting to the point where someone needs to have dialysis. So if you're in Arizona and you're a tribal entity and either of those two topics you're working on, those I would love to hear from you. So there's one more question here. Is there a way we can encourage our own tribes to participate in long-term support service for tribal assisted living? So I think just kind of how do we encourage the tribe to do this? So I don't know, Francis, maybe you'd like to address that. Tammy.
I'll comment also.
Okay, or Joseph. Okay, go ahead, Francis.
This is Francis, and I was thinking about our title, Voice the Need. That's how we started. We had these champions who just were persistent about voicing the need. And this means you go back to your elders and you find out because a lot of the elders can't speak for themselves. So you need to hear them out and then start voicing that need to your powers that be, to your council. I think that's the way we started. And as you know, the squeaking wheel gets the oil. So you got to be persistent. Thank you.
Good. Thank you, Francis. Joseph, you wanted to speak on this?
Well, again, just reminding the elders that they have a lot of influence themselves in all these various arenas that I spoke to earlier. I just spoke with my elders about an hour ago, and I was embarrassed because someone spoke highly of me in front of them. But because we don't do that, we're supposed to maintain our be humble and not be seeking glory. But I didn't seek out that praise. But the work again is valued by our people themselves, the recipients of the services. So again, but they just don't realize the power they have. So I would encourage all providers and program directors to really involve their elders in whatever way, in advisory committees, ensuring that they get to the leadership meetings with the state and also in the federal and local arena. So again, thank you.
Thank you, Joseph. Tammy, did you want to comment?
Well, I think, you need to approach the council, but I also agree with what Joseph and Francis said. You have to be persistent and you have to not give up in approaching the councils to say there is a need. We need to put together what we have to do, to get services in our own communities so our people do not have to travel and go far away from home, I think is something that needs to be really considered.
And one of the things that Unite is working on is putting together some resource packets that we can make available to tribes. Part of that will be some case studies on how other tribes have done it. So as your tribe is looking at and evaluating how other tribes have done it, that would be a good method and an understanding for them. And Unite is poised at putting that information together. We're also looking at having our executive director be available for some outreach, visiting with you, whoever typed that question, to go out to your tribe and help you tell the story on what it takes to make it work. There's a lot of information in the Indian Healthcare Improvement Act of 2010, but Unite is again positioned to understand that piece of legislation and help your tribe access those services that are available.
Thank you, Ron. Those are excellent. And I think also just the power of the story is real important. So any stories coming out of the community can be used to help address needs. And we certainly have several excellent best practice reports on our cms.gov website. So the final question, number 7, unless one more comes in, is what are the pros and cons of adding Medicare as a payer source? And does that benefit outweigh the risk or the cost? I don't know, maybe Francis or Ron or Tammy.
Well, I can tell you, our nursing home here is owned by the Eastern Shoshone Tribe, and we do accept both Medicaid and Medicare. And I think the main thing with Medicare is to be very, very sure you have someone who is knowledgeable about billing and that you make sure you get all of those rates in. However, beginning, I believe it's October 1, Medicare will be doing the new billing of the PDPM model, and so that will change how Medicare will be billed. And everyone right now is scrambling to learn how this will be. There's a lot of trainings online for this payment method, and so be aware of that. But we haven't had a problem using Medicare at all for our tribal nursing home as long as we make sure that we capture everything we do, whether it's rehab, whether it's skilled nursing, whatever it might be. It seems to work okay. You just have to be very aware of meeting those needs.
I would just also want to add, you need to understand how the state that you are in is going to amend their state plan with CMS for tribal facilities. The Oklahoma facility, the Rosebud facility, Cheyenne River facility, and the Omaha tribe currently do not accept Medicare because it would affect their reimbursement from Medicaid. And so you really need to have a clear understanding. It's a good benefit, Medicare is, obviously, but at the same time, there might be a lot of things you can do with restorative care and medications through the Medicaid program. So before you jump into Medicare, you just have to have a clear understanding, like Tammy said, of what you're doing.
Thank you, Ron. Francis, did you want to add anything on that question?
Not at this time. We do use Medicare, and it's mostly for rehab or post-acute care. And we have a contract with a hospice program. They run it, but they use our building.
Okay. And again, Tammy mentioned the PDPM, that's payment-driven payment model, and so or patient-driven payment model. So again, that's something you can find through your local nursing home collaboratives, and we can help you with that too if that's something you don't know about and would like to know more about. Okay, anyone would like to make any final comments? I really appreciate every single person on this call today, and this Unite has come a long way since 2014. Like Ron said, we are poised to really make a difference here and be a resource for tribes, but not so much just at a very granular level, the elders, the people that we serve day to day. We want their lives to be good, and we want them to be able to age in place if that's what they want. And so we're trying to do everything we can to accomplish that. So thank you for being on this call today. We appreciate it. We appreciate your questions. And Julie, I'll hand it back to you.
Great. Thank you, Debbie. In closing, I would like to remind everyone that today's webinar was recorded and that the audio and presentation slides will be made available online at cms.gov on the Tribal LTSS Technical Assistance Center website. Thank you again for joining today's webinar. Our session is now concluded.